Hi everyone, and welcome back to my channel. In today's breakout video, I'm going to be covering ABO blood groups, Rh factor, and blood typing. This is usually a topic that you see in the cardiovascular blood chapters of anatomy and physiology, but you may be covering it in your other courses, so I hope this helps you understand these concepts. Okay, so first things first, if you haven't already seen my video on antigens and antibodies, please make sure that you stop this video now and watch my previous video on antigens and antibodies. It is really important that you understand how antigens and antibodies interact with one another if you're going to understand how blood groups and blood typing works. So now that we got that out of the way, let's look over a little bit of terminology. First, agglutinogens. Agglutinogens are genetically determined assortment of antigens that are found on the surface of red blood cells. We're going to be referring to a few agglutinogens as we go through the next slides. Blood group. The blood group is based on the presence or absence of various antigens. Okay, so that's why I said if you haven't already seen that video, it's important to watch it because you really need to know what an antigen is. This is going to make more sense in the next few slides. 2 or more different blood types are in a given blood group. Okay, so in order to be a group, it has to have 2 or more different blood types. And there are at least 24 blood groups and more than 100 antigens. But when we talk about blood groups, we really focus on the ABO and Rh. These are the most common when you talk about what blood type you are. These are the 2 most common blood groups that we refer to. So let's look at the ABO blood group. Whenever you look at this blood group, you probably see a chart very similar to the one that's in front of you. And then you get this really overwhelmed feeling because you don't really understand what it means. So what I want to do is break it down, and hopefully at the end of it, you'll understand exactly why the different types got their different names, okay? So in the ABO blood group, you can either be type A, type B, type AB, and type O. So on the next few slides, I'm going to kind of break it down and have you understand how these got their names and the various antibodies that we find associated in the blood of the various blood types. So how do the different blood types in the ABO blood group get their name? In order to understand that, we have to refer back to the agglutinogens or the antigens that we had referred to before that are found on the surface of red blood cells, okay? So for instance, if you are referring to type A blood and you look at the red blood cell of a type A person, their red blood cell has on them what are called A antigens. A antigens. Okay, so on the surface of the red blood cells of a type A person with type A blood, their surface of their red blood cell is going to have these type A antigens on them. And just as you would assume, type B would have B antigens. Okay, obviously these antigens don't look like circles or squares. I'm just drawing them different so that you can determine one from the other, okay? So a type B person, their blood type is known as type B because on the surface of their red blood cells, you see B antigens, all right? So if we continue going on with this theme, hopefully you will get the idea that a type AB person, a person who has blood type AB, they would have both A and B antigens on the surface of their red blood cell. Okay, so they have A and B antigens. So this is how the naming came about, based on the antigens or those agglutinogens that are found on the surface of the red blood cell. So again, a type A person would have A antigens, a type B person would have B antigens, and a type AB person has both A and B antigens. And then we have type O. And the reason a type O is called type O is because there are no antigens. So on the surface of this red blood cell, there are no antigens. And that could be a little confusing because there actually are antigens, but there are no A or B antigens. So if we're just talking about the ABO blood group, there would be no A or B antigens on their red blood cell, okay? And that would determine that they were a type O. So hopefully this makes sense. If you're type A, you have A antigen. Type B, you have B antigens. Type AB, you have both. Type O, you would have neither A nor B antigen on the surface of the red blood cell. So that's where it got their names, okay? Now we're going to talk about the antibodies found in the bodies of the different blood types. Okay, so now hopefully you're familiar with the antigens that are found on the red blood cells of each type of blood, okay? So these are red blood cells, again, just to refresh. And we have type A blood would have A antigens on their red blood cell, type B would have B antigens, and so on and so forth. But now, whenever you're born with any one of these types of blood, you not only have these antigens on the surface of your red blood cells, but you also have antibodies naturally found in the body. And this is something that is unique because usually antibodies are made by a reaction where an antibody comes into contact with an antigen, and then antibodies are made through a process, which we'll talk later on in one of the immunology lectures. So it's usually a process, but in blood, for the type A, B, AB, and O, there are antibodies that could be found associated with the blood. And they do not have to be made, they're already there. So that's something unique, okay? So let's talk about the different types of antibodies we would find in each one of these types of blood and why this is important. So why is this important? Because depending on the type of antibody that's found in the blood, that could cause a reaction between the blood and the antibodies. So if you're thinking about giving a transfusion to somebody and you really need to know what type of blood they have before you're giving that infusion, okay? So a type A person, a person who has type A blood, who has those A antigens on their red blood cell, has anti-B antibodies. Okay, so the antibodies that are in their body are against the B antigen. That's what this means, okay? They are against B antigen. And that's not a good thing because if this person comes into contact with type B blood, then there's going to be a reaction between those antibodies that are in their body and that B antigen on there. Because remember, antibodies bind to antigens. A type B person has anti-A antibodies, okay? And again, that's against the A antigen. Now, here's something interesting because type AB has both antigens found on the surface of its red blood cell. So this one actually has no antibodies against A or B, okay? And that's because both of the antigens are already present. So because they're already present on the red blood cells, they're already part of that person's body, and so the immune system recognizes them as completely normal, and they don't have a reaction against it, so they don't have any antibodies. But a type O person has both anti-A and anti-B antibodies. Okay, so against A and against B. And again, it's really important when you're thinking about what type of blood to give somebody that you know this section here, that you know which antibodies they have, because that's going to help you determine which blood they can and cannot have based on the antibodies that their body naturally has. Now, Hopefully, looking at this depiction, you don't get crazy overwhelmed or you feel anxiety, but you understand that the antigens found on the surface of the red blood cell give that type its name, and that there are corresponding antibodies also found in the blood as well, okay, that relate to those different antigens that are found. So a type A person would have A antigen on their red blood cell, and they would have anti-B antibody found in their blood, okay? And so you can go through the chart. We've already talked about all of these, and hopefully that makes sense to you. Now, the reason it's so important to know what antibodies somebody has in their blood is because if you're giving a blood transfusion, you want to make sure that you're giving them the right type of blood. If not, something called heme agglutination can happen. Now, the term agglutination just refers to the clumping of antibodies and antigens. Okay, as you see in this picture right here. So if an antibody can bind to an antigen, then they can start clumping together like you see in this picture if there's enough of them in the same place at the same time. And we can see that happen in the blood. If there's a blood transfusion, right, that's going to be given into the blood, and in the blood is where all these antibodies would be, and so we can have a very large reaction. And because we're specifically talking about a blood reaction with red blood cells and antibodies, that's specifically referred to as hemagglutination. So agglutination can occur just in general with antibodies and antigens, but more specifically, if we're talking about red blood cells like we are now, we can refer to that as hemagglutination. So if you give somebody a transfusion with the wrong blood and the antibodies bind to this wrong blood in the blood, then we can start to have blood clots forming in the blood with this hemagglutination occurring, and that could lead to death. So we don't want that to happen. If you take a look at this chart, it shows you the different type of antibodies that we would find naturally in the blood of different types. So type A blood would have anti-B antibodies. And so if we give this person any blood with a B antigen on its surface, there's going to be hemagglutination occurring. So in this chart here, if we gave them AB, because there are B antigens on the surface, we're going to have agglutination. And if we give them B, we would also have agglutination. O, there's nothing on the surface to react with. And A, they are type A, so they don't have antibodies against it, so they would be fine with that. So a type A person could get O or A blood. A type B person would have A antibodies found in their blood. So if we gave them anything with A antigen, they would have a reaction. So they would have a reaction against AB blood, and they would also have a reaction against A. They would be fine with O and B. Type O has both anti-A and anti-B, so anything with that, they would have a reaction. So if they were given AB, B, or A, they would all cause agglutination. So the only blood that type O can receive is type O. AB has no antibodies because remember, both the antigens are found on its cell surface, so they can actually take any type of blood with no agglutination at all. So that leads us to the idea that AB then is the universal recipient. You may have heard this term before. And what that means is that they can receive any type of blood because they lack the antibodies to have a reaction. So they can receive AB, O, B, and A. And type O would then be the universal donor. Because type O lacks antigens on its cell surface, it can be given to any type of blood without the reaction, because no matter what antibody anybody has, since there are no antigens on the surface of the O, there's no reaction. There's not going to be any reaction. So type O is the universal donor, can be given to anybody. Type AB can receive any of these. This brings us to the Rh blood group. Now, the Rh blood group was named because the antigen was first found in the blood of the rhesus monkey. This one works like this. If the Rh antigen is present on the red blood cell, if it is there, then those individuals are labeled as Rh positive. Okay, so if it was there, let's give it a different shape. Okay, if that Rh antigen is there, then we can refer to those as Rh positive. If it is not there, then it's Rh negative. Okay, so this is there or not there, positive or negative. So that kind of makes it a little bit easier, and now you probably understand that you can be A positive or A negative, B positive or B negative, and so on and so forth, right? Depending on whether the Rh antigen is there or not. This one is a little bit different with the antibodies because normally neither one would contain any antibodies against Rh at all. However, if somebody is Rh negative, okay, if someone is Rh negative, they have the ability to make antibodies against Rh. And that is because, remember, a person who is Rh negative does not have antigens on the cell's surface. And so if they come into contact with the antigen, then the body is going to recognize that as foreign and create antibodies against it. So an Rh negative person can make antibodies against the Rh factor, while an Rh positive person will not, because they have the Rh antigen there. The body recognizes it as being normal, and it won't make any antigens against it, okay? But unlike the ABO blood group that we were talking about before, these antibodies are not naturally found, they have to be made, okay? And that leads us to something called hemolytic disease of the newborn. And this is what happens if an Rh negative mother is pregnant with an Rh positive fetus, okay? It will not happen in the other way. It will only happen if it's an Rh negative mother and she's pregnant with an Rh positive fetus. Since she doesn't naturally have those antibodies, then the first time she's pregnant, okay, if when the baby's born or any kind of blood transfer were to happen, if the mother were to have any contact with those Rh antigens, she would make antibodies against it, okay? And so that's what they're showing you here between pregnancies. The first pregnancy, the baby was born, their blood mixed, she came into contact with that Rh antigen, she made antibodies, and now she gets pregnant again, and she has another Rh positive baby. Now this time the antibodies are going to be able to pass through, okay, and then start binding up to the Rh positive found on the red blood cells, okay, of the baby. And that's going to make the baby not be able to carry enough oxygen as those blood cells get bound up. And so that's not good. Then the baby is born very blue, not getting enough oxygen throughout the body. So that's not something that you want to happen. So obviously if a mother is Rh negative and there's a chance of her having an Rh positive fetus, the doctor can intervene during that. And again, this is something that is really unique to the Rh factor. Because the antibodies are not normally present, they have to be made, okay? This could be even something that would happen in a blood transfusion. If a person had if a person was Rh negative and they received Rh positive blood, then they could have a reaction if they had made antibodies against it. Maybe the first time they'd be okay, but now that they've received that Rh positive blood, they're going to make antibodies against it, and the next time it's not going to be good, okay? So the first time an Rh negative person comes into contact with Rh positive antigen, it's going to make antibodies, and then the next time agglutination could occur, okay? And that could lead to death. So now hopefully you understand about how blood types got their name, the A, B, ABO, and then adding that Rh factor, whether it's positive or negative to it, okay? Well, now let's say we want to find out what type of blood that person has. And that has to do with mixing blood with different anti-sera containing antibodies. So we're going to take somebody's blood, their red blood cells, and then we're going to mix it with different antibodies that we know that were manufactured, okay? And I'm going to show that to you on the next slide, and we'll describe how this happens. And then we're going to see agglutination. And if it agglutinates, then that's going to indicate now that those antigens are found on the red blood cells. So this concept gets a little tricky because now you've kind of just wrapped your head around the idea of ABO blood group, positive and negative Rh, and you think you pretty much understand that. And then let's say you go into the lab and you go to blood type, and now you're totally confused again, okay? So let's kind of talk through this on the next slide. All right, so what we're looking at here, let's forget about the antibodies that are found in the blood of each individual. That's the first thing you have to do. That's important when we think about giving blood transfusions and making sure we give somebody the right blood, and we don't want to mess that up. That's important. But for blood typing, in the sense that we want to find out what type of blood somebody has, we are going to just forget about those antibodies, okay? Forget about those antibodies for a minute, and all we're going to think about right now are the red blood cells, okay, in the individual. We want to think about the red blood cells that are in each individual and what antigens they may or may not have on their surface, because that will tell us if they're type A, type B, etc. Okay? Now, the antibodies that you see here that we're mixing, anti-A serum and anti-B serum, are just things that we've made in the lab. We know that anti-A serum will react with a antigen, and anti-B serum will react with B antigen. Okay, let me write that here so you can see that. So B antigen with anti-B and anti-A. Okay, that's what they're going to react with. Okay, so we made these in the lab and we're just going to mix them. So somebody comes in, we want to see what type of blood they have. What they're going to do here, what you see here, okay, let's kind of just look at the top. They're going to put 3 drops is what they do at first. And so this is our control column right here where the blood has not been treated with anything, so you can see what it looks like. Then they're going to put a drop of blood in this column, and then 1 right over here. And then they're also going to put a drop of the anti-A serum in here, and then a drop of the anti-B. So what you're seeing here is in this circle, we see agglutination. In this circle, we see no agglutination. So what that is telling us is that in the circle we see agglutination is the anti-A. So that is showing us that there is a antigen on the surface. Okay, why? How do I know that? I know that because when they put the anti-A serum, the anti-A antibodies in here, there was a reaction. So the only way that anti-A antibody could react is if there was a antigen on the surface. And so we see that reaction, and now we know that that's blood type A, okay? The next column, you see it reacting with only the B. When I put the B, anti-B serum in here and mix them together, then there was a reaction, there was agglutination, so that's telling me that there is B antigen on the surface, which is why that reaction is occurring. Remember, we're only trying to find out what antigens are on the surface of the red blood cells so that we can determine what blood type they are. In AB, we would see reactions with both the anti-A and the anti-B, and that would let us know that that was AB blood. And then O would have no reactions. Why? Because O has no antigens on the surface, so there's nothing for it to react to. So this would tell us what the blood types were, right? What antigens are found on the surface of the red blood cell. And now that we know what blood types they are, then we can go back and think about what antibodies they naturally have if we were trying to give a transfusion, okay? If we found that they were a type B,
And then we would know that they would have type A antibody found in their blood, and we would not want to give them anything with A. So we would only want to give this person either B or O. Okay, Rh factor is not shown here, but Rh factor would be very similar to this if you were to do the same thing. Okay, so if they were Rh positive, sorry about that, or Rh negative. So if they were Rh positive, you would see agglutination. It would kind of look like this. When you put the anti-RH antibody, you would have to use anti-RH in this case. You would see agglutination, and then in the Rh negative, pretend this looks like the other beautiful blood smears, you would not see agglutination, okay? Same concept here. The Rh positive would have antigens on its cell surface that would react with the antibodies, and then the Rh negative would not have antigens, so there would be no reaction. So then you would be able to tell whether the person was positive or negative. So kind of going back to our universal recipient and our universal donor, we can be even more specific. And remember, we said that the universal recipient was AB. Well, now we can say that the universal recipient is AB positive, because if they have that positive antigen there, then they can receive any blood, positive or negative. And then the universal donor, more specifically, would be O negative, right? Because if there's no Rh factor and you gave that to anybody, then they wouldn't have a reaction, okay? Hopefully this video helps you understand ABO blood groups, Rh factors, and how to type blood a lot better than you did before. Please remember, if you like this video, to please like the video, please share it, and subscribe to my channel. Thank you so much.